Imagine a situation where every single minute matters, where the difference between a full recovery and lasting challenges could come down to how quickly you or a loved one receives care. It is a powerful thought, isn't it? When it comes to something as serious as a stroke, this idea isn't just a metaphor. It is a literal truth that guides all emergency medical care. For most people experiencing an ischemic stroke, which is caused by a blood clot blocking blood flow to the brain, the primary treatment window for a clot-busting medication called tissue plasminogen activator, or TPA, is within 4.5 hours from the onset of symptoms. Beyond this, 4 larger clots in major brain arteries, another highly effective procedure called a mechanical thrombectomy, can sometimes be performed up to 24 hours after symptoms began, though earlier is always much better. The reason these timeframes are so critical lies in a powerful concept known as time is brain. During an ischemic stroke, brain cells are deprived of oxygen and nutrients. Scientists have found that roughly 1.9 million brain cells die every minute that a stroke goes untreated. This loss is not just about cells. It is about functions like speech, movement, memory, and personality. The longer the brain is without blood flow, the more extensive and irreversible the damage becomes, making a full recovery much less likely. Knowing this, your immediate action is the most powerful tool you have. If you suspect someone is having a stroke, remember the FAST acronym: face drooping, arm weakness, speech difficulty, time to call emergency services. Do not try to drive yourself or the affected person to the hospital. Call 911 or your local emergency number right away. Emergency medical personnel are trained to recognize stroke symptoms and can transport the patient to a hospital equipped to handle stroke care most efficiently. When emergency services are called, they can activate a stroke alert even before arriving at the hospital. This means the stroke care team will be ready and waiting as soon as the patient arrives, saving precious minutes. It is also incredibly important to try and determine the exact or approximate time the stroke symptoms first appeared. This information helps doctors decide which treatments are appropriate and safest for the patient, as the treatment windows are strictly based on symptom onset. Understanding these tight time limits empowers you to act decisively and quickly. Your rapid response in identifying stroke symptoms and calling for immediate medical help can dramatically influence the outcome, reducing disability, and greatly improving the chances for a more complete and meaningful recovery. Every moment truly counts in preserving brain function and future quality of life.